kerajaan memutuskan untuk melaksanakan Perintah Kawalan Pergerakan 18 Mac 2020 di seluruh negara.
Assalamualaikum. First and foremost, let me introduce myself and my group members. My name is Nur Amira binti Amiruddin. My group members is Nur Nazira Nafisa binti Zulkafli, Syahiratunisa binti Shazlan, and Muhammad Afiq Farhan bin Muhammad Talib. On 25 January 2020, Malaysia announced the first case of COVID-19 in which the patient developed symptoms from the Chinese tourist who had crossed the border from the Singapore 2 days before. Therefore, on 16 March 2020, government made an announcement of the Movement Control Order, which is MCO. In addition, this MCO has led to prohibition in gathering nationally as the way to preventing the disease and isolating the origin of the cases. The MCO also that resulted from the COVID-19 pandemic, however, has generated the significant obstacles for public in order to do their daily routine, and thus it give bad consequences to individuals' mental well-being.
Since first being recorded late last year in China, COVID-19 coronavirus has spread all around the world, and then been declared a pandemic by World Health Organization. COVID-19 can be defined as illness caused by a novel coronavirus, now called Severe Acute Respiratory Syndrome coronavirus 2. The COVID-19 pandemic has affected many people's psychological health, including Malaysian. First is the loss of money and work are linked to rising depression, anxiety, stress, and low self-esteem among society. A recent survey by recruitment company JobStreet has revealed up to 20% of the respondents have been laid off amid the ongoing COVID-19 pandemic. Losing a job leads to feeling of confusion and uncertainty that ultimately interfere with the mental well-being, which leads to feeling of anxiety and depression. Furthermore, a survey conducted by Nimita et al. 2020 shows that individuals who lost job and income reported adverse mental health effects from the coronavirus concern or stress. Additionally, the result of the survey indicates that a higher proportion of households experiencing job loss or income describe that concern or stress over the coronavirus has caused them to encounter negative mental health impacts such as difficulty of sleeping or eating, and increased consumption of alcohol or substance use. Besides that, adults who report job loss during this pandemic are more likely to experience anxiety and depression compared to adults who do not report job loss.
Or the second point is the risk of quarantine and isolation might be trigger the bad psychological effect on individual. It is because according to 2020, a longer period of quarantine can result a high prevalence of psychological distress such as post-traumatic distress which associated with the symptom of depression. Apart from that, Mungam 2020 says that social isolation might also arise panic, anxiety, sorrow and sadness that will strengthen the mental stress towards society and oneself. Besides, the lack of social and physical interaction with others were often shown to induce loneliness, dissatisfaction and a sense of alienation from the rest of the world that was distressing to the individual, which indicated by Wilkin 2020. Therefore, Johari 2020 stated this social distancing may disrupt the social routine of individuals that will put their mental well-being at risk. To support this idea, based on study by Kama 2020, since the orders of stay-at-home were issued, it can be found that 47% of those who are quarantined reported negative mental health effects resulting from the stress related to COVID-19.
Nowadays, the accessibility of information is as easy as at our fingertips, which is its advantage on the COVID-19 pandemic. But these advantages give a drawback on inauthentic rumors that lead to the psychological the adults who receive the inadequate information from social media, which is triggered stress. Social media was the medium of spreading information, but in the terms of transparency, it is a crucial part, and inauthentic information could result in psychological distress. A poor information from public health authorities and insufficient clear guideline about action to be taken and makes confusion about the purpose of the quarantine. It has been proven that the lack of specific about the multiple risk level of the pandemic will result to the public stress even worse. Besides that, the stigma about community toward the people could lead to psychological distress. For example, the healthcare worker face stigmatization as they are spreading agent of the virus to others. In addition, people tend to stigmatize and reject someone who had been quarantined by acting differently toward them. For example, avoiding, withdraw from social interventions, mistrust, and make critical comments.
The next point is exhausted and strained in frontline workers give a psychological burden to them. Apart from the general public, health workers also have the potential to experience psychological stress while managing COVID-19 patients. Frontliners, including paramedics and ambulance, will probably show high level of stress, depression, anxiety, as well as being emotionally and trauma. They will feel fearful that their family will be affected with COVID-19, feel tired of long working hours and have to face a stressful situation such as lack of adequate protective equipment. The worry and stress over the coronavirus cause them to experience some effects such as difficulty sleeping or eating, increase the alcohol and smoking consumption, and subsequently worsening their health. Besides, some health workers who undergo quarantine are more likely to feel tired, isolate themselves from others, feel anxiety when dealing with patients who have symptoms, worse working performance, and reluctance to work or consider quitting. A recent study from China states that among 1,257 healthcare staff working with COVID-19 patients, 50.4% recorded depression symptoms, 44.6% reported anxiety symptoms, 34% reported insomnia, and 71.5% reported distress. This is because health workers who work in emergency department, intensive care unit, and isolation ward have a greater risk to infected with COVID-19 than those from other departments, possibly because they are directly exposed to the infected patient and their work is highly demanded.
In order to combat the negative impact of COVID-19, steps in identifying and securing the high-risk group was an effective way to be implemented. The practice of social distancing and other safety measures among older adults is the best way to secure them from the disease. In the meantime, providing practical and emotional support to them, while psychiatrists and experts perform local observation analysis so that results can be provided a basic, effective, and efficient approach to implement to minimize the impact toward the high-risk group. Besides that, the high level of anxiety, depression, and stress are reported by women, while students experience greater psychological distress due to the closing of the school to limit their interaction with others. A strong support from healthcare staff is necessary, and the manager should be aware of possible risks from their employees that have been quarantined so that they can plan for earlier interventions.
Next, boost the motivation of health workers by giving moral encouragement. It is important to safeguard the moral and mental health of the health workers, as this can influence the success of the healthcare delivery. Cyrus et al. 2020 suggests that organizations could consider to reduce the working hours, gives daily rest time or rotating shifts if necessary. Besides that, in times of need, managers should make a deliberate effort to assist the workers, or a peer support scheme could also be set up. Next, it can be found that the encouragement from the colleagues and the consistent flow of comments from the supervisors, as well as the interference of precautionary steps, can help to minimize the psychological symptoms. Apart from that, using standard instruments such as the Effect of Event Skill Revise (IESR) is recommended to the healthcare professionals during public health crises.
The third strategy to overcome this issue is by dissemination of health and disease outbreak to the public. Mental illness education is necessary to minimize the stigma and encourage more individuals to come forward to seek for help for the psychological distress they may encounter during the COVID-19 pandemic. Besides, the government and health authorities must deliver accurate, evidence-based health information about the outbreak to the public in a timely manner through traditional or new media platforms to minimize the detrimental of the social media fake news. For instance, WHO and Center of Disease Control or CDC have put up an information pamphlet and issued a statement to fight the stigma against the Asian. It is hoped that by educating the public about the COVID-19, it directly will reduce the fear of the virus and the discrimination. This general education about the disease, the rationale of the quarantine and public health information provided to the public can beneficial to reduce the stigmatization. As a result, a higher satisfaction of the health information received has been found to correlate with the lower psychological distress. For the last point is boredom and isolation can be reducing by boost individuals' connectivity and interaction with others. In order to accomplish that, according to June 2016, quarantine people should be given practical guidance on coping and stress management strategies. For example, it is worth considering to the introduction of online and smartphone based on psychoeducation on the outbreak to promote mental wellness and psychological intervention such as cognitive behavioral therapy and also mindfulness-based connective therapy, which stated by Ho 2020. Other than that, Chi 2020 indicates that behavioral therapy also can allow people to overcome anxiety and depression by adjusting their schedule of daily routine. Last but not least, Ho 2020 says that online platform may also be a means for individuals to provide social support in order to convey their problem during the COVID-19. This means, according to Rubin 2020, social networking should play an important role in enabling people who are quarantined to update their family and friends about their condition and convince them that they are well safe. In conclusion, it is clear that pandemic COVID-19 leave a negative impact in every inch of psychological well-being, although the impact may vary depending on the situation faced by the society. Additionally, it is necessary to take action of this matter to emphasize the effort to curb the psychological distress. Lastly, every party should play their role effectively so they can give strong support to the individual that has frustration during COVID-19, and this could result the successful strategies outcome to help all of them.